Hi everyone, my name is Dr. Carrie McKenzie. I'm a rural generalist with RACGP. My background is that I'm a Flinders graduate who moved back to my hometown of Darwin to do internship in PGY2, and from there moved out to a smaller town in the NT. Initially working mainstream and then at an AMS, but I was in a more isolated locality outside of the township. So some of you might recall my talk from earlier this year that I was invited to do. So sorry about that. I did cry through a lot of that. I'm in a much better place now, but I'd just like to talk about what happened to me. So I was, look, a lot of things happened whilst we were living in that town, namely that I had my supervisor go mildly rogue and he ended up getting reported to AHPRA through the hospital system. I had the loss of an unborn child from a mumps outbreak in our community. And that was fairly harrowing, but mostly that there was this increasing violence within the community towards each other, but also targeted towards the clinic. People would set fire to the clinic, they'd come in and threaten the staff. One day someone came in really drunk, we had to evacuate all the women and children out the back of the clinic and lock him in the waiting room until the police came, which was wow. But mostly increasing tragedy in the community, and those of you that have worked or had exposure will understand that when there's one tragedy, the process of mourning and sorrow often results in more tragedy, and this just has a snowball effect going on and on and on, which can, markedly affect people that are working in that community as well. So how did I recognise that my mental health was slipping? Well, I didn't at the time, but ultimately I started to recognise that I gained a lot of weight. I've actually gained 35 kilos. I was using carbs in all their form as a medication, so I was eating too much. I was drinking a lot of alcohol. I was really snappy to my kids and my family. I lost a lot of joy in my hobbies. I'd get intense nausea and fear of going to work, and easily brought to tears at work, with little things that happen. So, ultimately there were 2 days where I said goodbye to my husband and children, with a clear-cut plan to kind of finish up. But luckily for me, my husband came home early both times. And now, looking back, I'm just so shocked that a job can push you that far. I never want to get there again, and I never want anyone else to get there again. So, sorry. So, how did I try to get out? So I talked to my husband, who's also a RG, about changing jobs. I didn't get a lot of support there, and at the time I was surprised, but I said, what about here? Oh, don't work there, XYZ. Or what about here? Oh, don't work there, ABC. What I didn't recognise that he was actually probably suffering just as much in his own different way. So I stayed, and boy, did I feel trapped. And I felt very cornered, which is not a feeling I like to have. So I spoke to my town-based employer. Since I wasn't able to go anywhere else, I could have, of course, I just didn't see it at the time. I spoke to my employer about transferring out of that particular position into a position in the town-based facility. Lots of excuses were given. Firstly, there was no staff to replace me. And as I pushed that, there might be staff, but not just yet. And then there is someone, but they're not trained on your computer system, or we use a different one. So would you change all your clients over? So 350 clients I manually moved from one system to another. It took about 3 or 4 months, and I finished on Christmas Eve. And then I was told that there was no staff to replace. I ended up resigning in March, so I hung on for another 3 months. Probably wasn't giving quality care because I was crying a lot. I ended up resigning. A doctor was found within days to replace me, and my resignation was rejected. I was rotated into the main clinic and took on aged care and the main clinical lead, which was really good for a while because what I needed was a change. But then COVID hit, which was a complete disaster. Management decisions were just fly by night, not thoroughly considered. All staff got exposed to COVID. I got isolated from my family for 2 weeks, and as an Aboriginal doctor, I was just waiting to be plucked from my accommodation and taken in the back of a, RAF vehicle up to the Centre of Excellence in Darwin. It was very, very stressful. During that time, my community my previous community got an outbreak of COVID, and one of my old patients died. It was very stressful. It was a very stressful time. I ended up resigning and took 2 weeks off and moved to the hospital where I took on, I created the COVID outpatient response for the whole region, created 2 new GP training programs across both the colleges, cleaned up secure messaging from the hospital to all the health sites in the region, and I did all of that in 10 weeks. So I would argue I was not, in fact, burned out, which is a term that I actually don't like very much because I still could perform and I still could do my job. And I think what happened to me was actually repeated and increasing intensity moral injury that just again and again and again and again that led to me to be so depressed and cornered that I considered suicide my only option. So I did eventually recognise that my situation was unsustainable and did try to get out. But you think in that situation that if there's no one to replace you, the people that you're serving will suffer, and so you stay. We took an oath, of course, and we're loyal. But many of our employers aren't, and we're cogs in a machine. And when we get squeaky, they'll oil us to a degree, but we'll be left to turn. We'll be threatened, we'll be bribed, or we'll be manipulated until we break. Not all employers are like this, but certainly my employer was like this, and I'm sure there's many out there like this. So I've got to rustle along. So where am I now? I'm across the country. I've given up having childcare and after-school care and school holiday programs for my kids. What that means is I need to be there for them. So I physically cannot work, which is kind of good because I'm someone that will quite obviously take on way too much. So I'm doing medical education now at a university, and I'm finding this really, really, really rewarding. After being a sole doctor for so long, my confidence took quite the walloping, and it's really nice to be able to deliver a topic on a subject and realise that actually I do know it, and I know it quite well. And it's, but mostly what I enjoy is helping the students navigate the ethical dilemmas that they're seeing, because I have such a wealth of experience with ethical dilemmas now, thanks to my experience up there. I'm learning the medical culture of my new hometown at arm's length, which is good too, because I'm not putting myself back in clinical situations that might be toxic. From my position now, I can see which ones are toxic and avoid them so that I have some self-protection. And I have a professional work plan laid out now. Personally, no one's asked that of me, but for the next 2 years with a graduated return back to clinical work. And I've been really, really honest with my employer about my limitations this year due to the experience that I had. So I have set myself no clinical for a year, and I intend to stick to that, despite the fact that that there could easily be 8 of me and that people would still be asking more. So what I want to leave, the last quick message is, as more of us drop away and drop out of medicine or, change careers, we actually become more valuable. We are sought after and we do have choice. We just often can't see it. Sometimes that choice is transfer within an organisation, and sometimes it's resignation. And sometimes it's moving away, because that was the thing that helped me the most. I actually could not be in that town anymore. You might find mentors in unusual places, and for me it was on an online Facebook group for general practitioners. I was able to find the other clear rural leaders in that forum who didn't know any of the people that I was talking about, and could one-on-one help me navigate my way out. And for them, I'm indebted. So seek out unusual mentors. It's usually not the people directly around you, because they're usually struggling in their own way, and we are very good at having a facade. And I think my husband was in the same situation, just quietly. And so we have to care for ourselves, because in any organisation with deliverables, that's going to be their priority, and we will be used as a cog. So find mentors in unusual places, recognise your signs, and don't be afraid to call it quits, because you can't fix the system. The system's broken. Thank you.